We are tracking some breaking news out of Oldtown right now. Police are not sharing much information about what they're dealing with, but according to the town of Orono, officers from that town are assisting Oldtown police and state police. Penobscot County dispatchers say because of the police activity you see there, detours are in place on parts of Stillwater Avenue. People are being asked to avoid the area. We do have a crew at the scene. We'll keep you updated as we learn more.
They haven't treated us well. The Canadian officials have treated us very badly. They're nasty people.
Amid an ongoing trade war with Canada, President Donald Trump signing an executive order today renaming Lake Ontario to Lake America. Canadian officials, by the way, say they will be ignoring that move.
When asked what message he was trying to send Canada, Trump said no message. But the language of today's order asserts that Canada has invested, quote, far less money into protecting the Great Lakes ecosystem and shipping routes than the U.S. It also claims that the United States controls the majority of the lake's volume because the deepest points are under American jurisdiction. This is in spite of the fact that over 50% of the lake's surface area is under Canadian jurisdiction.
Now, the name Lake Ontario dates back at least to the 1600s, but more than a century before American independence. And like last year's executive order renaming the Gulf of Mexico, this order only directs U.S. government agencies to use the new name. And that includes federal agencies like the National Weather Service. So it's unclear how many organizations outside the federal government will follow suit. That was also the case with the Gulf of America. Most other countries have not adopted that name, although Apple and Google chose to update their map services in the U.S. Meanwhile, Canada is now removing seafood and fish products from its counter-tariff list.
The Canadian government said, based on feedback they got from various industries, they decided to roll back that particular tariff to protect against broader economic harm to the country. The change is particularly significant for Maine's lobster industry, which has been caught in the crossfire of an escalating U.S.-Canada trade dispute.
It was great news that tariffs were dropped today, especially Maine lobster. This year has been significantly more difficult. Low lobster prices to the boats and high expenses. Bait's high, fuel's high, and every year they keep getting higher and the lobster price seems to be getting lower and lower.
The Maine Lobstermen's Association said a proposed 25% tariff on American lobster would have severely disrupted one of Maine's lobster's most important markets during the height of the fall fishing season. A group of Maine nurses gathered outside of Senator Susan Collins' Portland office to protest the money donated by Palantir executives to her campaign.
Maine Health is also a client of Palantir, which provides data analysis and software to the hospital system. Our Christian Harsa covered the protest around noontime today. He joins us in the studio with more. Hi, Christian.
Hi, Brian and Amanda. The connection here is Palantir. It's a data analysis and artificial intelligence company that has been under stronger and stronger scrutiny for its contract with Immigration and Customs Enforcement, ICE, and the vast amount of data that the company oversees. As for the nurses, they want the tech company out of their politics and healthcare company. For 10 minutes, Middle Street in Portland was blocked off by union nurses protesting Palantir. Letters allegedly written by children in ICE custody on the front doors to the building of Senator Susan Collins' Portland office.
When will our punishment end? When will we be free? No family should ever be separated or have to stay detained for months.
Nurse Kelly Brennan helped organize the demonstration.
It's just so sad.
The nurses are protesting Collins' connection to Palantir. In the past couple years, campaign finance reports show Palantir executives have donated about $113,000 to Collins' campaign and Pine Tree Results, a super PAC that has been making ads like this one attacking Collins' competitor, Democrat Troy Jackson.
Troy Jackson voted to allow.
While at an event in Millinocket on Thursday, Collins was unaware of the protest or the nurses' demands.
I have been happy to receive support from donors all over the country as well as the state of Maine.
Nurses like Meg Sinclair have already protested Maine Health's contract with Palantir twice this summer.
For Maine Health to funnel money at this evil corporation is
completely evil.
Maine Health says the tech it uses from Palantir is to fix insurance denials and ultimately help patients. The hospital system also says all data is protected by HIPAA. After talking with the senator, the Collins campaign reached out to CENTER Maine, claiming Maine Health's use of Palantir technology has saved patients millions of dollars. It helps level the playing field for Mainers when our hospitals appeal denials by the big insurance companies. For context, the roughly $113,000 Palantir executives have donated to Collins' campaign in the Pine Tree Results PAC represents a small fraction of the nearly $40 million those two entities have received in recent years, representing less than 1/3%. Brian and Amanda.
Christian Harsa live in our studio. Thank you. Meanwhile, state legislators, healthcare providers, and community members are all in Augusta right now discussing the future of maternal care centers in Maine.
This comes as birthing units like Maine Health's Miles Delivery Center in Damascotta are closing. Today, Maine Health and members of DHHS shared how dwindling birth rates and the inability to attract specialty healthcare workers have been the main contributing factors to these decisions. Legislators and several community members argue the state needs to look at funding programs to promote specialty care providers moving to Maine.
We have to adapt our systems to accommodate the lifestyles of the physicians who are now coming out of school and the lives that they want to live with their families. And that's sort of a dynamic that hasn't been addressed and I think is putting pressure on the system. But recruiting more doctors is certainly something that we have to look at as a state and especially in our rural parts of our state.
The legislators say they will continue discussing how to implement potential solutions as the next legislative session approaches in December. New data shows the cost of feeding a family is rising, and more people across the country are turning to food pantries.
A new Feeding America report says that between 2020 and 2024, 64,000 more people are now considered food insecure, a nearly 70% jump. The increase comes as grocery prices in the United States continue climbing. Meat in particular has seen the biggest increase. Between 2020 and now, the cost of ground beef has gone up roughly 77%, according to the Bureau of Labor Statistics. Food pantries all over the country say they are struggling to keep up with the demand as more people turn to them for help.
And some of these folks had been folks who are donating to us. They've been donating food, they've been donating funds, and now they are also struggling. Folks are visiting pantries for the first time ever in their lives. Folks are visiting more frequently.
Now, Feeding America's report isn't all bad for Maine. Compared to 2020, a 10% larger share of food insecure Mainers are now eligible for SNAP.